In this lesson, I'm going to better explain fundal height to you and what it means in some different situations and scenarios. So first, we need to really understand what fundal height means, so what the definition is. So the fundus is going to be the top of the uterus, okay? So the top, and it's going to be palpable, so something we feel and assess. So here's our fundus on our uterus, so that top point there. So we are assessing this during pregnancy and during the postpartum. So during pregnancy, it's used to measure the gestational age. So how far along this woman is, and to make sure that the baby's growing okay in there. So we measure from the base, the pubic symphysis, up to the top of the fundus, and I'll show you that on another slide. So importance during the postpartum. So during postpartum, we're going to be feeling on that fundus after delivery to make sure that it is able to correctly move to the bottom, that we're not bleeding too much. So during the postpartum period, it is going to be described as either being firm or boggy. Okay, so firm or boggy. So we think of firm as going to be kind of that, like if you were to feel like softer kind of a ball, it's firm. So like a volleyball, you're pushing on a volleyball. Boggy is going to be when it's like a foam ball, so it's kind of squishy. We want firm. Firm is what we're looking for. Boggy can mean that we're filling up with blood too much, and so we're going to be worried about a hemorrhage happening. And then we are also measuring where that uterus is during the postpartum that's going back into the pelvis. So it's just to show that the woman is correctly healing after delivery and that that uterus is moving back down where it should be to the pre-pregnancy state. So here, doing our fundal height assessment, just to look at the two in more detail. So during pregnancy, we want this patient to lie on her back, not flat, okay? So we worry about that hypotension, supine hypotension happening for these patients. So we want them at an incline so that their blood pressure doesn't drop. And then we're gonna measure, and that's gonna be done, we measure from the pubic symphysis, so down here, so the base, to the top of the fundus, wherever it may be. And you can see the different weeks here. So let's say the fundus is here. It's going to be measured in centimeters. We have our tape measure here from the pubic symphysis up to the fundus, and we measure that it is 28 centimeters. That means she's 28 weeks, or the baby, the fetus, is measuring 28 weeks. So that's what we're going to be doing during pregnancy. Now in postpartum, we always want to make sure the patient has emptied her bladder. We want her flat on her back now so we can really palpate it. And we're going to do the palpation of the fundus. So if you see down here, it's important to know we always want to keep one hand down here at the base, because if you push up here at the fundus and don't have a hand at the base, you could push that uterus through the vagina and prolapse it. So we always need to have that hand there as a support. And then we're going to be measuring the finger breaths below the umbilicus. So this here is 1 finger breath. This is 2. So if you're up here and you're getting 1 finger, 2 fingers, then we would call that U minus 2. If you were at this first line, you would be U minus 1. U stands for umbilicus. So it's how many fingers you can get underneath there. Again, it's measured in centimeters or in the finger breaths, because that's what you're using on assessment. So if you were up here and you got 1 finger, you would be at U plus 2. And then, of course, this point at the umbilicus would just be U. Let's compare the fundal height difference between when someone is pregnant than with somebody during the postpartum time frame. So during pregnancy, the fundus is moving up. It's going to be moving up, or it should be, because that baby's getting bigger. So if our pubic symphysis is here and the fundus is here, then at each prenatal appointment, we should be measuring it higher and up. So it should be moving upwards, showing that the baby's growing. If the fundus is not moving up, it's showing us that maybe there's a problem, like the baby's not growing correctly. So this is showing us how the fetus is measuring or growing. So same thing, if the uterus is, let's say that this point here is 20 weeks and the patient comes for a 20-week appointment, but the fundus is up here, it's showing us that that baby is growing too fast, too big for some reason. So it just kind of shows us that so we can look further for why and what's happening. Now during the postpartum, the fundus should be moving down, so it's the opposite. So this is when the uterus is trying to move back into the pelvis, back into that little cavity. So we have our umbilicus here, and we want to see the fundus moving down. So we want to see U-1, U-2, U-3, and so on. And remember, that's going to be with our finger breadths or the centimeters. So centimeters or the finger breadths. So for this, the big thing is that it is going to move down or should move down 1 centimeter or 1 finger breadth every 24 hours, so Q 24 hours. So at U-2, if she is at U-2, we would expect her to be 48 hours postpartum. This would be a whole nother day, okay? This would be 24 hours postpartum, her U-1. So what's important to know here is right after delivery, and this is usually a good test question, right after delivery, we are, so let's say after delivery, we are at U or U+1-ish, and then we start to move down. So at the 24-hour point, we're going to U-1. The reason why after delivery it's at this point is because the uterus is still kind of filling up with blood. It's trying to contract its way down. So it is going to be at U to U+1, and then we'll start to move down after that. Let's look at the timeline of the fundus after delivery, just to make it more clear. So immediately post-delivery, the patient's uterus should be at U to U+1. Which means that the umbilicus or slightly above. And then it's going to slowly move down thereafter. Now we are 24 hours postpartum. When we hit 24 hours, the fundus should be palpated at U-1. Oops. Start this slide. All right, so now we are 24 hours postpartum. When we hit 24 hours postpartum, the fundus should be palpated at U-1. The uterus should contract down 1 finger breadth every 24 hours, okay? So this is a guideline, and different situations are going to obviously cause different occurrences, but this is the rule of thumb that we should go by. Usually this will be a test question, okay? So just make sure you understand each day where it would be. If in the question, the patient is only that 10 to 12 hours postpartum, then they're going to be here at that U to U+1. When we hit the 24-hour mark, we'll be at U-1. Now that the patient is 48 hours postpartum, where would we expect to find the fundus? Right, at U-2, so we're 2 days. Now, I want to make sure you are aware that the uterus is not going to keep being felt at, the 6-week follow-up appointment. Because the uterus has moved itself back into the pelvis, right? So the uterus is going to the pelvis cavity. Eventually, it has to reach a point where we can't feel it, right? So this point is going to be at 2 weeks, at about 2 weeks. So this is another good test question that can be asked. So if the patient at 2 weeks calls and says that she can't feel whatever was being felt at the hospital, or the patient's at the doctor and the nurse can't feel the fundus, it's okay. If she's at 2 weeks, we expect that because that means it's moving back into the pelvis where we want it to be. So it's a good thing. We should not expect to feel it at 2 weeks. Our therapeutic management for this patient is going to be to make sure she's comfortable with whatever we're doing, explaining what we're doing for her. So either she's at her incline if it's during her pregnancy check, or she's flat if she is in the postpartum. This can be a very uncomfortable assessment during the postpartum period because we have to push kind of hard, make sure that we are firm and not bleeding too much. So we want to make sure she's comfortable. We also need to ensure that she has emptied her bladder. To review, if you remember that a full bladder is going to cause discomfort as we're pushing on that uterus. And also in the postpartum time frame, it will cause the uterus to measure higher. Okay, so the bladder is going to irritate also that uterus and push on it. So it can make bleeding heavier is the big thing. So we should always make sure that they have an empty bladder, and they should be going frequently to make sure that that full bladder is not irritating the uterus and causing heavy bleeding. So the last piece to understand is going to be for our gestational age doesn't match the measurement. So what this means, if the measurement doesn't match up, what does it mean? It means we're either too big or too small. So this would be that patient that's pregnant and getting her measurements done for her fundus. So remember, if the uterus measures 28 centimeters and that patient is really supposed to be 30 weeks, then what's happening? That baby is measuring too small. So we need to try to look for reasons as to why. Is the baby not getting good nutrition anymore, or what exactly is occurring? So this gestational age measurement with a fundus allows us to actually check on the fetus and how it's doing in utero. So education for this patient should include why we are checking. Okay, we always need to explain what we're doing and why we're doing it. That way she knows exactly what we're measuring for. When the patient is postpartum, why do we check? We need to tell her why we're checking because of that discomfort that we're causing her. We really need to know, let her know the why so that she is more understanding that it is for her safety. The pushing on the fundus and checking is just really uncomfortable. You can also let the patient feel, which is a kind of a good little intervention to do, so that she can feel it and know what it is and what it means. It is also going to be really important if you let the patient understand the importance of emptying her bladder. Since that is such a huge thing and a preventative factor for postpartum hemorrhage, then it will help her be more aware that she should probably empty her bladder every 2 hours, because this is going to help ensure that that uterus stays firm. And remember, it's firm or boggy is how it is described. Boggy is going to be like a soft foam ball. And then our firm is like a volleyball or an orange. It's just that harder feeling. Our nursing concepts are going to be reproduction because a patient is or was pregnant, and human development because the size of the fundus has to do with how well the development of the fetus is going. All right, the key points to remember is that the fundus is going to be the top of the uterus and it's palpable. It's what we assess. We can look for gestational measurements. So we want to measure from the pubis symphysis to the fundus. So if our uterus, here's our fundus, we're measuring the bottom all the way up to the top. So as that uterus starts to grow bigger and bigger, we're measuring to the top. And then description, either firm or boggy. So firm means the uterus is contracting, which is what we want because we want that the uterus to contract down into the pelvis. And then boggy, you can remember bleeding, B and B. We worry that we're going to have a postpartum hemorrhage if we're not already. So we need to get it from boggy to firm. And the way that we can do that is by massaging it. So rubbing hard on it, rubbing or massaging the fundus to get it to the muscle fibers to contract, and then it'll firm up, which is what we want to see. So make sure you check out any resources that are attached to this lesson. Now go out and be your best selves today, and as always, happy nursing.